Paul Farmer wrote a book called Infections and Inequalities. In many ways, infectious diseases in their pandemic form often are exacerbated by social and economic inequalities fostered by political policies and decision-making. In the 1970s, there was an outbreak of a disease in a hotel in Philadelphia in which members of a fraternal organization, the American Legion, were infected with some sort of illness. Within weeks, we had figured out that this was the emergence of a new disease by an existing pathogen called Legionella, colloquially defined as Legionnaire's disease. But the American biomedical establishment moved quickly to determine who was at risk, what was causing this disease, and to stop it in its tracks. At the beginning of the AIDS epidemic, met by sort of benign neglect, disinterest from the people who could have slowed the outbreak when it started in 1981, but it mattered who was getting that disease. Again, it was gay men, it was people who used drugs, it was sex workers, it was poor people, and they simply didn't matter. They were disposable. When we talk about neglected diseases, I often ask the question, neglected by whom? There are many diseases that we don't worry about in the United States, but they are either treatable or require more research, which we just simply ignore around the world. Yale School of Public Health has many people working on many of these neglected tropical diseases, but they don't get very much spending by the National Institute of Health or other research agencies in the United States. It's because who gets them? It's not Americans, it's not Americans who matter. It's people outside of our borders who even matter less to people at the top here in the United States.